How do you approach that when someone maybe in their 20s comes into you, for example, and says, I'm really struggling? Where do
Yeah.
you start?
Yeah, well, I guess in that kind of scenario, the first thing to say is, how is it affecting you? Because, most people are not coming to see you as a doctor because they think their period pain is normal.
Mm,
It's
mm,
not settling with paracetamol and ibuprofen. That's why they're coming to
mm.
see you. So the first thing is just to kind of explore, how is it impacting you? Are you having missed days of school? Are you having to miss days of work? Are you missing social events? Are you finding you can never wear white trousers because you're just going to get the most horrendous
Mhm.
flooding during your period, or you're just worried that that's going to
Mm.
happen? And they're really massive things. They're embarrassing things. And often people don't even like to talk to their own friends or family about what they're experiencing, because we've been pre-programmed, haven't we, to find these things kind of
Disgusting,
embarrassing.
or
Yeah, like,
yeah.
oh, it's not something to be talked about, the fact that I have flooding and I have to wear a sanitary pad and a tampon, and I can still leak through and it all goes over my bed covers.
Mm.
Those are things that people feel that are just,
It's just
no,
me, no one
yeah,
else. Yeah.
yeah,
And you
yeah,
feel quite on your own with these things. So
yeah.
I'm assuming, like, I did hear of one young woman that came to see you and she came away saying, this doctor's changed my life. Um, and there's a lot of people that probably come to you after not being listened to, and that is life changing. And how does that make you feel, like professionally and emotionally?
Oh, I mean, that's the nicest thing that anybody could ever say, is that they go away from seeing me and feel better. They feel better. And sometimes it's not even the medication that you prescribe. It sometimes is just having the time to be heard.
Mm. Hmm.
Just to be able to tell your story. Somebody's listened to it and taken it seriously. You've not felt dismissed. And there's not always treatments that you can give people, but sometimes just be able to validate how they're feeling and say, actually, what you're feeling is because of this, and that's normal that you feel that way because of what you're going through.
And that happens at every